we'll get started. Welcome, everybody. This is a pretty small group, so we probably won't go for the full 45, 50 minutes. My name is Alexis Del Vecchio. I'm a third-year emergency resident, about to graduate at Mayo Clinic. And today, I'm presenting what I'm calling the Fun Workshop, an acting and theater-based approach to improving connectedness with yourself and your patients. What qualifies me to teach you this, in addition to being a doctor, I'm a professional actor. I've acted in film, TV, commercials, theater. I'm originally from Montreal, and I've done a lot of French voiceovers. So I'm the French voice of Anakin Skywalker in Star Wars. And I've been in a lot of different projects. I've worked behind the scenes. I've produced Hallmark Channel Christmas movies as well. Worked in Hollywood for a couple of years. And then in my mid-20s, decided to do a complete 180 and was like, I'm bored with this, I want to become a doctor. And now I'm at the end of that journey. But going to med school, I knew I wanted to somehow use that background to help improve healthcare. So I've been teaching different versions of this course to different learner groups, medical students, nurses, attendings in practice, fellows, both nationally and internationally. The course at times is as long as 3 to 5 hours. This is like a mini version of the course. Raise your hand if anybody in this room in the last 6 months in your workplace has felt stressed out, burned out, anxious, exhausted. Yeah, I think that includes. Please come in. I think that includes all of us, especially I think with the way the volumes are, right now in all the ERs, around the country, boarding patients, no beds for psych patients. I think we're all really stressed out. And so this workshop is about helping improve our mindfulness so we can provide better care for our patients. I have no actual or potential conflicts of interest in relation to this presentation. All right. So I introduced myself a little bit for those walking in. This is the theater workshop. I'm an actor, if we can go around the room and everybody, if you guys could introduce yourselves, let us know who you are, which institution you're coming from, what your level is, if you're a resident or attending, and why you wanted to attend this workshop. We'll start with you.
My name is Jeffrey Hom. I'm from Stony Brook University at Long Island, and I'm faculty there with the Department of Pediatrics and also Emergency Medicine. And I think this is a good understanding of how can interact with patients. I preface this. I went to a course once that talked about medical malpractice. This guy, half jokingly, but half kind of meant it, that to kind of avoid any kind of like med mal suits against you. He said, quote, pretend that you like your patients so you don't get sued. But it really comes down to like paying attention to your patient and showing that you're engaged into it. And then when I saw this course, I thought this is just an interesting way of, another way of looking at it as well.
Yeah.
Or interacting with patients.
I'm glad you mentioned that. I didn't include it in those slides, but oftentimes I mention it. In almost every malpractice suit, there's an element of, I feel like my doctor was a jerk, or wasn't listening to me, or wasn't communicating properly. And so that's a big, that's a big aspect of it for sure.
I'm Nick from Grady in Atlanta and Harmsworth.
Wonderful. Great.
So sorry. The sessions are being recorded. We encourage you guys to speak into the microphone so that they catch the
Gotcha.
conversation.
I didn't know it was recorded. Is it
Sorry
video?
about that.
Is it video recorded?
No, just audio.
Okay.
Yeah, so we got you hooked up. We're just recording anything that's speaking into this.
Okay.
Yeah.
Test. Okay. That's intense. All right. So we were just introducing ourselves. If you want to go ahead and tell us about you.
It's on already.
My name's Christine. I am a pharmacist with the South Carolina Department of Mental Health, and I feel like I've really learned how to work and talk to psychiatric patients, but I'm actually transitioning roles to pediatric emergency medicine, and so I have a whole new patient population to communicate with, as well as parents, things like that. So just any types of ways to improve that communication, I think, would really benefit me in this new role. So
Awesome. Thanks for being here.
Good afternoon, everyone. My name is Satya. I just finished med school at Virginia Tech Carilion in Roanoke, and I'm about to start a combined emergency and internal medicine residency at the University of Maryland. Honestly, I saw this and I was like, hey, this sounds like fun. Let's do that. But always looking for new ways to get creative and kind of help forge better connections with patients in that short time that we have in the ED.
Awesome. Maryland is a great place. I was just there in shock trauma. It's a pretty crazy place. Yeah.
Can't live in pink scrubs.
I may have stolen a pair of those pink scrubs off the record. Go ahead.
My name's Andrew. I'm a first-year resident at Virginia Tech Carilion. I have some like clowning experience, and I've always thought like, how do I merge this with my normal everyday ED practice? But I feel like this would be a nice little segue.
Awesome.
Hey there, I'm Jeanette Wolf. I'm at UMass Bay State. I think difficult conversations and conflict is one of the most challenging things we do, and establishing rapport. I'm always collecting a little bit more for my bags of not pissing somebody off when I don't need to.
Hello, I'm Andrew Wong. I'm faculty at UC Davis. This was among the list of talks that were interesting for us on the wellness committee. So yeah, decided to see what it's like.
All right.
Hey everyone, my name is Anthony Cito. I'm from University of Calgary in Canada. I do a lot of event medicine and raves. I'm like the rave doctor. So at our site, we meet our team members for the first time. So always finding ways to do energizers, icebreakers, or team activities to see how we can improve communication amongst our team members.
Hey guys, I'm Osman Herrera, one of the second-year resident physicians at Allegheny Health Network St. Vincent's Hospital, and thought this seemed like a lot of fun. I think getting that initial HPI and getting the patient to trust you initially is a very big, important component in getting the right diagnosis and taking care of your patient, especially those that are just like pulling teeth, trying to get the info out of them. I'm sure y'all know what I'm talking about.
Hi, I'm Arman. I'm finishing up my third year of med school at Mount Sinai in New York. I was interested because I feel like I used to be like a more creative person. Like I did like theater and like in college was like an a cappella and stuff. So this looked fun.
Sounds good.
Hi, I'm Rachel. I'm an M1 at Cooper Medical School, Brown University. My undergrad was at Stony Brook, though. And I'm here because I'm a medical student ambassador assigned to this, but it seems like it's going to be a lot of fun.
And you'll be participating with us. You volunteered to participate. Yes, that's right. All right, so this is a great group, a very diverse group. Thanks, everybody, for being here. So a little bit of background. A lot of you talked about communication and how do we improve our communication with patients. Albert Mehrabian was a psychologist at UCLA, and he hypothesized that about 93% of communication is nonverbal. That is to say that about 7% of the meaning that we transmit to other people is through our words. About 38% is the way we say it, our voice, tone, etc. And about 55% is actually your body language. And so acting provides a unique approach to improve our nonverbal body language with patients. A couple things I want to go over, setting the stage. Let's have fun. I'm going to ask you, and I know it's hard because we're all physicians and we're brainiacs, I'm going to ask you to turn your brain off today. Don't try to rationalize. There might be some things that in the moment don't make sense, but hopefully by the end of the session they do make sense. And what I also invite you to do is be in the moment, be present, enjoy what we're doing, and leave the reflection for later. So in a couple hours, or maybe tomorrow, maybe a week from now, think back on what we did, but don't try in the moment to necessarily rationalize why it is that we're doing different things. At times you may feel silly, embrace the silliness, keep an open mind, and I want to emphasize that this is a safe space. Psychological safety is very important. At times you may feel like you're stepping out of your comfort zone. That's okay, embrace that, and we'll all have a lot of fun. All these exercises are very innate to me. I went to acting school, but I'm going to try to give as clear explanations as possible for all of them. If there's any questions, just let me know. Our learning objectives are as follows. We're going to implement practical tools to improve our connectedness on shift. We'll identify literature that supports that mindful physicians actually provide better care to their patients. And we will apply 3 mindful, actually there's going to be more than 3, but by the end of the session, you'll be able to have 3 mindfulness hacks to improve your presence in the moment and better your communication with patients at work. So a lot of this is about mindfulness. There's a lot of definitions out there of mindfulness. I really like this one because I think it encapsulates the whole idea. Mindfulness being the idea of purposely bringing your attention to the present moment, being fully engaged with your thoughts, feelings, bodily sensations, and surrounding environment. And that usually involves a heightened awareness of sensory stimuli. So being aware of your breathing, the sensations in your body, while also being free of judgment from your own thoughts as well as the people around you. And so, to get started on our journey, I'll have everybody stand up. And I want everybody to feel very grounded, so sort of feet like this, okay, hands up in your pockets, very good. Feel the ground under you, like you're a tree, like a tree trunk. And I'm gonna have to, I won't be able to do this with this. 2. All right, and we're gonna play an exercise called Crazy Eights, or Shake It Up. And what we're gonna do is very simple. We're gonna take our left hand, and we're just gonna shake it, you know. And it will count down from 8, very loud. And we'll go 8, 7, 6, 5, 4, 3, 2, 1. Then we'll do the same thing with that, and 8, 7, 6, 5, 4, 3, 2, 1. Then same thing with that foot, 8, 7, 6, 5, 4, 3, 2, 1. And then same thing with this one. And it will come down from 7, and from 6, from 5, from 4, all the way to 1. And as you do this, I want you to shake off whatever thoughts, emotions, anxieties you had inside of you, whatever mindset you came in this room, you just shake it out with your lips. And we're going to come out very loud at the same time. So we'll go on my count on 3, 1, 2, 3, and 8, 7, 6, 5, 4, 3, 2, 1. 8, 7, 6, 5, 4, 3, 2, 1. 8, 7, 6, 5, 4, 3, 2, 1. 8, 7, 6, 5, 4, 3, 2, 1. 7, 6, 5, 4, 3, 2, 1. 7, 6, 5, 4, 3, 2, 1. 7, 6, 5, 4, 3, 2, 1. 7, 6, 5, 4, 3, 2, 1. 6, 5, 4, 3, 2, 1. 6, 5, 4, 3, 2, 1. 6, 5, 4, 3, 2, 1. 6, 5, 4, 3, 2, 1. 5, 4, 3, 2, 1. 5, 4, 3, 2, 1. 5, 4, 3, 2, 1. 5, 4, 3, 2, 1. 4, 3, 2, 1. 4, 3, 2, 1. 4, 3, 2, 1. 4, 3, 2, 1. 3, 2, 1. 3, 2, 1. 3, 2, 1. 3, 2, 1. 2, 1, 2, 1, 2, 1, 2, 1, 2, 1. 1. Woo! All right. Everybody can have a seat. I probably should have a disclaimer, like if you have asthma or you're pregnant, you know, before you do this exercise. I'm sorry.
Or wearing heels.
Or wearing heels, yeah, that too, exactly. And so, Crazy 8, to me, that's an exercise about mindfulness and centeredness. You know, this idea of before you go into your shift, like shaking it off, whatever emotions, whatever emotional baggage you bring. I use it even after difficult traumas, difficult, you know, resusces. I mean, not necessarily like in the hallway be like shaking it off, but just in my head, like shaking off the encounter I just had, you know, with that family. And, oh, yes. Shaking off the encounter I'm having with a family. And oftentimes I find that, you know, your consultant or someone will say, hey, take 5. And it's like, well, what does that mean, take 5? Like, am I going to go like do laps around the department? Do I go outside, you know, and get some air? And I think just using this to get you out of that mindset so that you can, you know, have an open mind with your next patient is something you can implement in your practice. I've had people take this workshop that say they do it like on their way to work or back, you know, from work before they go and meet their family. So I think there's a lot of different ways you can implement this. So we talk about mindfulness. Just a shorter definition of this, again, being fully present in the moment without judgment, being aware of the environment without distraction, and focusing on experiences that unfold around you. So what does this matter? I'm talking a lot about mindfulness. There is a large body of evidence that shows that mindful physicians provide better care, they have less stress, decreased rates of burnout, and actually they work for longer. And for all of you involved in medical education, as you may know, a medical student's empathy goes down once you enter the clinical sphere, you know, 3rd year, and it sort of goes up again by 4th year. And same thing with residents, and specifically emergency residents. You see that going from being an intern To second year, again, your empathy goes down, your burnout, increases, a lot of it due to increased clinical responsibilities and the fact that we forget, to care for ourselves and to be mindful. So this is good medicine for yourself and for your patients. And so that's the first tool that I hope you can take away from this session is just physical presence. Feeling your body in space without judging yourself, being grounded so that you can have an open mind when you go and meet your patients, which is, I think, exceedingly difficult in our busy ER environment. The next game we'll play is called Yes and. This is from the improvisation world. And so I'm going to have everybody stand up and pair up. So whoever is, closest to you, you can form a pair with. Hopefully we have an even number. Otherwise, I'm happy to, let's see, 2, 2, 2, 2, 2, 2. Perfect. Oh, that works out perfectly. All right. Excellent. And so this is an exercise from the improvisation world called Yes and. In improv, you're creating a scene with your scene partner out of nothing. And so the idea of Yes and is that whatever that person is going to give you, you take, and then you build that scene together. But we've adapted this for the clinical realm, and what we're going to do is this. I'm going to give you a prompt. One of you is going to play a patient. The other one is going to play a physician. We'll just role play. And for each of you, when you interact with your partner, each sentence you say is going to start with yes, but. Okay? So each time you respond to the person, the first words you're going to say are yes, but. Okay? That'll be the first iteration, then we'll do a different version of that. And the problem I'll give you is you've got a patient coming to your ER who wants opioids. He wants a refill of his painkillers. And you've checked the database, and he's a chronic opioid user, and this is for his chronic, low back pain. You've done imaging. There's nothing of concern. All he wants is painkillers. Okay? Any questions? No? All right. Go ahead. Yes, but yes.
Oh, sorry.
So it's gonna be easier if you make statements as opposed to questions. Yeah.
Okay. I saw that you were saying lots of other providers. Yes, but what do you mean? Yes, but.
Pretty good. Make sure so each time you reply, yes, but is the first thing you're gonna say. Mm-hmm. Yeah. So this is all yes buts, yes. So each time you reply, both of you, the sentence starts with yes but. Mm-hmm. All yes buts, that's right. Yes.
Yes, but you need a follow-up experience.
And it's going to be easier if you make statements as opposed to questions. That's going to help you out too. Yeah.
Yes, but I am not going to Yes, but we don't really have supervisors.
And same thing, but start with yes, but. Both of you guys, yes. Yes. That's fine. That's fine. You'll still get something out of it, but both of you guys. That's great. I'm trying to, you guys, did you also go to Yale? Oh, are you guys, like, partners? Oh, gotcha. So you're going to Yale, or? Oh, wonderful. That's fantastic. I went there for undergrad, so that's what I was asking. All right. All right, excellent. So everybody did really good. So just to be clear, yeah, each time, both the provider and the patient, start with those words. We're gonna have the same prompt, okay? You can flip, so if you're playing, the physician, now you can play the patient. But now each sentence is gonna start with no because. Okay? No, because. So obviously, the very first statement you make, it wouldn't start with that, but every statement after that. And I will clarify, it's easier if you make statements as opposed to questions, obviously, to make this work. So same idea, flip roles, but now we start with no, because. Go ahead. Oh, wonderful. Yeah. We can, I can... No, exactly. The next... You're welcome to watch, and the next exercises you'll be able to participate in. Okay, perfect. Sounds good. We're doing like yes and, so, improv. We're doing a, version of that. And where are you coming from? Awesome. And what's your position? Oh, you're like a consultant there, staff? Yeah. Okay, wonderful. Awesome. I'm about to graduate from Mayo, ER, emergency medicine. Yeah. I was an actor before med school. Yeah. So hence this. I'm just listening in. You guys can keep going. All right, excellent. We're going to do this one more time. It's up to you if you want to play doctor or a patient. I'll leave it up to you guys. But now each sentence is going to start with yes and. So we're starting over again, same scenario, but yes and. Go for it.
Yes, and I understand that it would be, unfortunately, that news, because I know that's not what you're hearing. Unfortunately, that's not the policy. Yes, and I understand that. And I think that, unfortunately, there are some problems that we need to talk with. I can definitely relate to your doctor.
I'm just listening. I feel like you guys have gotten to know each other really well now. Oh yeah, you have to role play. Hence for acting. Yes, exactly. I'm just listening in.
Yes, and I was wondering, have you ever followed
Perfect. That's a great way to end it. All right. You guys did great. Let's give each other a round of applause. know this can be uncomfortable and it's a little bit different. You guys can have a seat. We're just going to debrief briefly. So, a couple takeaways about this. I know for me personally, yes, but is sort of my go-to, right? Like I feel like I say that 1,000 times a day, which is basically, you're lying, right? You're saying yes, but that has no meaning. And really what you're saying is, yes, I'm going to actually ignore everything you just said and tell you how I actually feel. The no because I actually use in clinical practice. And I've seen around the room, it was actually interesting, some interactions where I felt like with a no because, there was more of a pause, like you guys were actually listening to what the other person was saying, because then you had to justify your position. And so when I have, a disagreement with a patient or with a nurse, or I get pushback from an admitting service, I find that using the no because actually helps foster connection, right? Because you're being honest and you're justifying your position, and you're rationalizing and explaining why it is that this or that cannot happen. The yes and I find useful to use with difficult patients, right? Acknowledging whatever their issue is, acknowledging their pain or their frustration with delays, and that's something that you see a lot of conflicts in the workplace. People become defensive just because you haven't actually acknowledged the way they feel. And so I use the yes and to provide. Basically to highlight what they're saying, and tell them, hey, I hear you, I'm with you, and this is what I can do for you. And so our second tool is acknowledging the other person's emotions, their point of view, etc. Let's get on our feet again, and we're going to play an exercise called mindful breathing, which comes from acting, but also a lot of different other fields. And it's very simple. All we're going to do is, again, hands out of our pockets and to our sides, feeling our feet being very grounded, sort of shoulders back, feeling like a tree trunk. And what we're going to do is we're going to inhale through our nose, and then you're going to exhale. And as you exhale, you're going to say, ah. And I want this to be an ah, from your gut, like an ah, all the way, from deep within. And we'll keep doing this just for, just a couple times. And you all can go at your own pace. There's no rules here. I'll demonstrate. So this looks something like, ah. And that's it. It's not weird, right? I mean, this is totally, this is what we do at SAEM. I mean, all right, so whenever you guys are ready, on your own count, for yourself. You can close your eyes if you feel more comfortable. And we'll go one more time. Very good. All right, everybody can have a seat. So it's a very simple exercise, but studies have actually shown that you do this 3 times a day, and over time, your stress hormones, your levels of cortisol, your anxiety goes down, your sense of joy goes up, and that's something that you can do before shift or on shift. And when I was talking about oh, you had a difficult recess, take 5. That's something literally at your station, right? You may not say the awe, but just having that deep breathing, really grounds you and makes you feel present in the moment. I have a video about this, but I want to see. Yeah, we probably don't have time for the video, but I can send you this link. It's basically just a little bit more about about this exercise and the benefits and the evidence behind it. And some of these are sources about this. Other benefits: improved cognitive skills, performing better under pressure, greater ability to focus. And so it might seem silly at first, but there's truly science behind this. And so this is our third tool today to improve our mindfulness and connectedness, which is mindful breathing. Next, let's all get back on our feet, and we're going to try to form a circle here. And we're going to play a game called Pass the Impulse. And what we'll do is we're going to pass a pattern around the circle, both using words and our body language. And so the first pattern that we'll pass around is zip, zap, zap. So what I'll do is I'll start. But basically, you want to make eye contact with someone in the room, and then I'm going to zip to you. Yeah, exactly. And I'm going to use my body. And then I want you to show me that you got the impulse back. So in other words, like exactly, perfect. And then you'll make eye contact with someone else in the room. You'll go zap, we'll go up, and we'll just keep going like so around the room. All right? So I will start. Zip. Excellent. Great. Zap. Zoop. Zip. Zoop works too. Zip, zap, zap. That's good. Zip. Perfect. Zap. Zap. Zip. Zap. Zap.
Zip. That does a zap. Okay. Zap.
Yeah, I can see you got it. That's good.
Zip.
Zoop.
Zap.
Zip.
Zap.
Zup. Excellent. All right. We're going to do the same thing. This time, the pattern is going to be odd numbers starting from 1. So just 1, 3, 5, 7. Sometimes I make it more complicated. I kind of pull to 12. That's an unstarter. And this time, you're going to point at the person. Same idea. Make eye contact. Point at the person. Say the number. Show us that you receive the impulse, and pass the impulse around the circle. So. 1, 3,
5,
7,
9. Excellent. 11. And make sure again you show us you're receiving, the impulse. Yeah. 13, 15, 11, 17, 19, 21, 23, 25, 27.
24.
33. 35. 37.
41. 43.
45. 47. I'll give it to myself. All right. Next thing, have a ball here. I'm going to throw the ball around. So just making eye contact. What I'm going to do then, as we pass the ball around, is I'm going to add a second pattern at some point. I'm going to make eye contact with someone in the room, and I'll add the zip, zap, zap back in. So there's going to be 2 patterns going around the room. Okay? So you need to have eyes everywhere, and try to keep track of that. And subsequent to this, if we're able to have 2 patterns going on, I'll add the odd numbers pattern as well. So we'll have 3 different patterns going on at the same time. Okay? I've never had issues with this ball. It's been true and tested. There's never been any, HR complaints about, saying stuff. But still, let's be gentle, okay? So, this. No, perfect.
Sorry. Bad arm.
Good. You guys are doing great. So, as you keep going, this second pattern I'm going to add is the zip zap zop. And remember that the zip zap zop also has that movement that goes with it. Zip. Zap.
Zoom.
Zap. Zap. Zap.
Zoom.
Good. Great.
Zap.
Zap. So we're doing really good here. You guys are awesome. So the third pattern, as you guys keep going, is going to be I point and then odd numbers from 1. Zip. Zap.
Oh.
Zap.
Zoom.
Zip. 1.
5.
7. 9. 11.
12.
Zap.
13.
Really good.
17.
19.
Zoom. 21. What are you doing?
21.
Zip.
23. Zoom.
25.
Zap. 27.
29.
31. 31.
Oh, 35. All right. Let's give each other a round of applause. I hate to interrupt this. Usually I don't. It just breaks down. You know, and that ends the exercise. But you guys are really present, and we're able to. You know, well, you know, yes, I shouldn't underestimate my audience. And so, but you guys did really, really good. And so, a couple things about this. So we talk a lot about, you know, closed loop communication, right? We're all familiar with that concept. Using this, thanks for coming. Using this in resources, basically the idea being I send you a message, the person acknowledges receipt, and then you follow up. So can you order an ICU bed? Yes, I will order this ICU bed, thank you. So that's a mainstay of closed loop communication. But I don't think we focus as much on closed loop communication using our bodies, whether that's like eye contact, you know, with the person that you're with. As one example, I'm about to start a job, you know, in a couple weeks, community job where I'm going to be in 7 different ERs. And it's like the first day, you know, if I step into my shift and it's like, oh, here's a code. I don't know anybody's names. I don't know any of the nurses' names. And so, you know, saying to that person in the corner, you know, hey, are you recording? Great, thank you. Giving, you know, a tap on the back of that person, you know, can I put you in charge of, you know, meds, whatever. Having, you know, that eye contact, but using your body language as well, I think can improve our communication. This is also a component of active listening, right? I mean, we talk a lot about active listening, but active listening is really engaging and using your whole body to show to the person that you're listening to them, that you're attentive, that you're interested. I think, and this is a great definition, I think, of active listening, it's listening with all of our senses and giving your full attention to the person speaking. Now, this begs the question, what if you can't? I have a consultant who took this workshop who likes to use the EMR when he sees patients in the ED. And he noted that his press gain scores were really low because patients felt like, you know, paying attention to me, you're just focusing on the computer. And then he took this workshop and he made a very simple change, which is now he just actually tells the patient, like, hey, I'm focusing on you, I'm paying attention to you, but I just want to get the best history that I can. And so that's why I'm using the computer at the same time. And he noted that he actually went from being the lowest performing physician in his group to the highest performing physician on his patient satisfaction scores. So just saying that to the patient, if you're not able to make eye contact, actually can make a big difference. I think the other takeaway from this exercise is that it's a myth buster about multitasking, right? I mean, this is tough. I mean, even the zip, zap, zup, it was like, okay, so where are we at? Like, am I at the zip? Am I at the zup? Plus, at the same time, I've got, this body movement that I'm doing. But you guys were so great at the 3 patterns because you kept them separate, right? I mean, it was like 3 different patterns going on at the same time and you paying attention. And so there is no such thing as multitasking. I mean, this has been proven by evidence in a lot of different fields. There's such a thing as consecutive tasking, right? And so it's things like, if you're a consultant and, you get a history from your med student or your resident. I've experienced this myself, right? I present and the consultant's like, and they're like, typing something, sending like a message to someone, and I'm like, you have no idea. You have no idea what I just presented to you. You heard the first 2 words, chest pain, and then you just stop listening. Because we have so many interruptions in the ER, but giving your attention to each of these tasks consecutively, I think is much more productive, and also shows to other people that you care. And so our fourth tool, is basically accepting that there's no such thing as multitasking, but there is such a thing as consecutive tasking. All right, let's get all on our feet. And we're going to play, I think this is my favorite game. It is called 7 Levels of Tension. And if you're comfortable, I think this floor is pretty clean. So if you're comfortable, I want you to lay on the floor and be completely relaxed, okay? And basically, as you're laying on the floor, be completely relaxed. Basically, you are, without injuring yourself, I like that some people have a backpack, for your head. I want you to think you're a jellyfish. All right, you're completely catatonic. All right, you've got no bones. I mean, you are just jelly, being on the floor like so. Okay. In fact, you're on the beach and it's really hot, and you're sweating. You feel like you're melting, with the sand. Okay. All of your limbs are lazy. You feel them give away. Good. And as you embrace that feeling, you can start to sit up and stand up. And as you do, you'll start walking in the room, and now you're just chilling. You're like the California dude, all right? You're just like, you're in Venice Beach, having a good time. You're on the beach, it's sunny, you're just chilling out. You can walk around, acknowledge the other people. Hey, what's up? But still, just chilling. And now you're moving from chilling to just neutral. This is just a neutral state that you're in right now. You're just exploring the room and being neutral. And then we'll go from neutral to, now you're curious. Everything around you is interesting. Whether it's what other people are wearing, or what they look like, or what's in the room. You're in a state of awakening and being interested in what you're seeing around.
Look at that fish taco.
And now you're walking around and there's a threat in the room. You don't know who the threat is, but there's a sense of suspense. Something, something's awry, something's amiss. And now we'll go from the threat to you're feeling passionate. This is like an opera, okay? You are moving with intention, The threat is still there, but you're going to beat it. And as you go from this state, now you're entering a tragic state, all right? There, you're like a rabbit in the headlights, all right? You're walking a tightrope. You feel tense. Everybody is a threat. Everybody around you is putting your life in jeopardy. Everybody around you is a threat to you. All right, excellent. Let's give each other a round of applause. You guys are great. I appreciate you keeping up with this, being open-minded. And so so I won't show you this video. I don't show you this video because we don't have time here. But there was a video here about a French comedian in a state of curiosity. Jacques Tati, great comedian from the 1950s. He was basically the Mr. Bean of France. And he did all his movies without, it was all, nonverbal. And that scene is like 2 minutes of him being curious and looking at different things, in a kitchen. And the point I'm trying to make here is, as physicians, that sort of fourth stage of like curiosity or neutral is sort of the state, we're in, right? Like you're paying attention to the patient, you're curious, or you're trying to get to a diagnosis. The way I use this exercise is I've come to think of patients as each patient room that I enter is sort of its own little island, its own little raft of emotions. And sometimes the nurse gives you like a heads up, like, oh my God, a lot of drama in that room, or, they'll say like, oh, it's the saddest story, you have no idea, what's going on. And that's helpful, but sometimes you don't know, right? And it's like you walk in the room, you think you're gonna see the patient, and especially post-COVID, it's like there's 7 people in the room. I mean, the gospel choir is there, the preacher, the preacher is, you're like, oh my goodness, what is going on here? And so for me personally, being aware of like these different levels of intensity and emotionality in the patient allows me to adapt my communication with them and sort of meet them at their level, and sort of change my own body language in a way to mirror it if needed. And so that the fifth tool is read the room. Be aware of the emotionality in that room so you can respond appropriately to the patients. All right, I think we have time for 2 more exercises. And this one is fun. It's a cocktail party, but I don't have drinks, I'm sorry. So non-alcoholic cocktail party. So let's all get on our feet. And what I'm going to do is I'm going to give everybody in the room a card. Don't look at your card, okay? And then I'll tell you what to do after that. And what I want you to do is you're going to put that card on your forehead. So. Oh. Sit around. Okay. Okay, perfect. So you can put it to your forehead. Perfect. Yeah, I love you shut your eyes. You know what you do. That's good. Okay. So, I'll have you guys walk around the room, and the prompt is, well, actually, it's a cocktail party here at SAEM. All right, this is the welcome reception, okay? And you are your own self, whatever your position is. And I want you guys to interact with every person in the room as you walk around. But I want you to treat them based on the status ascribed to them by the card that is on their forehead. Okay? So if they're a king or a queen, you're going to treat those people like that. I mean, oh my, you want to network with these people? And two, you know, then, well, that's like, I don't want to have anything to do with you. Okay? So go around and,
Hey, how are you?
how are you? All right, good job. How are you? I love your smile. Don't flip your card yet, okay? What we're gonna do is, I wanna read from a line, all right, from, if you think you're the highest status, you would be at this part of the line, middle status right here, and then, you know, sorry, at the lowest status, people would be right here. So from highest status, kind of like somewhere in the middle, to somewhere over there.
It's better not.
Is everybody feeling pretty good about where they are? Alright, so flip your card. And so I see all of our royalty is right here. And I've got a middle, sixes, and tens, and I think all the here. Excellent. All right. Let's give each other a round of applause. We're almost out of time, so I'm going to just zoom through a couple things. Everybody can take a seat. I'll collect. Yeah, I can collect the cards. You can just leave them right there. And so it's interesting, right? I mean, very quickly you became aware of what your status was based on the way that other people were treating you. And also, it was interesting to see like the kings amalgate, you know, together, and then the lower status people also would form, you know, the same group. And what I hope it brings attention to, and this is something I'm, you know, barely brushing, you know, the surface of, and I'm by no means an expert on, but the idea of unconscious bias, right? The idea that like we treat other people a certain way based on our own, you know, stereotypes that, you know, we've been raised with. I also think it brings attention to, you know, we talk about premature closure in terms of premature closure for diagnosis, but I think we do that with patients too, right? I mean, they walk in based on the way that they're dressed. We make, based on, you know, their gender, their age, how well kept or unkept they are, we prematurely close, you know, on them. I remember, you know, in med school, these two pictures were shown to me as a first-year med student, and the question was, who do you think has HIV? And it's easy to say, oh, well, you know, the homeless man, but the truth is, you don't know, you know, until you get more information. And vice versa, you know, patients make assumptions about us by virtue of having a stethoscope, wearing scrubs, that alters, their perception of you, and it's also depending on what previous experiences they've had, in healthcare. So our last tool is just being aware of uncovering, your biases and realizing that you have power over your status, right? I mean, based on the way you present yourself, based on the way you use your body language, actually you can change the way that other people perceive you, which is acting, and which, to your point, is, if you act like you care, even if you're burned out, you're exhausted, you don't have the bandwidth, that makes a difference, for the patient. So I know you guys are going to other sessions. We're almost out of time. We won't have time to do more, exercises, but a couple last things I want to bring up are what are patients looking for in their provider, in their doctor. The studies show they want someone they can trust, someone who's honest, non-judgmental, and someone who projects warmth and openness. And that's something that you can portray with your body language. They want someone who's empathetic, and studies have shown that if they perceive you to be empathetic, they'll also perceive you to be more competent, and there's actually a decreased chance of malpractice as a result. And so putting it all together, all these exercises, when I meet a patient, the questions I ask are, what do I see? Who is there in front of me? Who else is in the room? What do I hear? What are they telling me? But also, what do I fail to see and what do I fail to hear? What is needed? What is it that the patient wants? And where am I at in that state of mindfulness? Where are my emotions at? We won't have time to do some of these, but the last tool I wanted to introduce is to embrace failure. So sometimes we have time to do an exercise, which is basically we all take a bow and say, I failed. And I know it's tough, because we're physicians, we're not used to that, but I want to invite you to embrace that. So real briefly, the tools that we introduced today are being physically present, acknowledging other people's emotions, mindful breathing, consecutive tasking, read the room, uncover your biases, and embrace failure. I will leave you with 3 quotes. This is from one of my mentors, who's a dramaturg and playwright in New York City. She says, failure of communication is the predication of drama. I think almost every conflict, every war is based on a failure of communication. The founding dean at my med school, and I'm misquoting him here, said to me often, have the grace for yourself that you have for your patients. And one of my mentors at Mayo, Dr. Miami Guru, says, patients do not care how much you know until they know how much you care. These were our learning objectives and some further reading here. Thank you so much for your attention.